Welcome to MetaViews from Metavate Consulting. Who we want to help.
Hello, so in this next section, we're going to be talking about how Metavate can help industry and what our target audience and clients are. And Con, I think I'll start by just asking you. We've worked together for, I think, just about 15 years now. And one thing I would say about you is that as an academic, you're quite entrepreneurial in terms of helping and working with particularly, I mean, obviously huge multinationals, but also with startups. And I wonder if you could just say a little bit about your experience of working with industry and obviously your experience with government grants as well.
Thanks, Andrew. Well, look, I think it's very hard to be entrepreneurial within a strictly university academic environment. So this is why Metavate is so exciting for all of us, I think, is that we can sort of take a step out of academia and work more closely with industry. And I think, you know, we have the same goals, is whether it's to help a startup company or whether it's to help an existing larger company working in this space. You know, it's the same goal, is to take cutting edge research, you know, research coming out of neuroscience and cognition, human trials, animal trials, in vitro trials, and to help build better products, to understand the mechanisms of the brain, and to help guide the collection of evidence and understanding of products, but really to build much more efficacious, more exciting products, and to help companies do that. And so, you know, obviously industry is our main goal, but, you know, we're also here to help educate the community in terms of what natural medicines and nutraceuticals actually work and how they work. And, you know, it's the over-the-counter sales, sure, but also to help GPs and naturopaths and pharmacies better understand efficacious products. So, you know, this is a really exciting time. There's great research being done. We understand more and more about how these medicines work and what are the biological targets in the brain to enhance cognition. So we're really looking for partnerships with industry to realize some of these goals.
Thank you. And Nigel, maybe I'll flip that question and just ask about your experience coming from the business angle, your experience of working with universities in the university sector.
That's a loaded question, Andrew. So we've found it generally quite difficult. So a lot of challenges in unlocking some of this leading edge science out of universities, because administratively it can be quite difficult. We had a clinical trial where the university concerned changed their mind right at the end of signing the contract and wanted to own the IP and license it to us, and we were paying for the trial. So we actually refused to do that, and eventually they caved in. But it's a lot of administration and difficulty working directly with universities around the world. I think the exciting thing about Metavate is that you get the smarts without the complexities. So to have the benefit of the both of you and our broader team of in our networks, without the constraints of some of the difficulties of working with universities, I think is a win-win scenario for industry and of course for us, in order to help as many companies as possible. So it's and the innovation side, I think, to your earlier question to Con, I think, you know, the both of you, from my experience of working with you these last 15 years, is that you are very focused on the solutions, the end benefit, and about how to apply the science to results, rather than being a kind of academic sort of right into the basic science and quite a long way away from the translation. So I'm very excited to be with you guys in particular, out of you know, the scientific sector, that we've got, you know, a combination of skills that we can really help companies deliver business results as well as just pure science.
I think, as well as the three of us, one thing that's worth mentioning is that Metavate is very, very widely connected. We have a vast network of collaborators, both within Australia, where we're currently based, but also lots of connections in Europe, in the UK, in North America, in Asia, in China. And I think we also know the organizations where some of those barriers that you two have mentioned perhaps aren't as hard to overcome. And that's, I think, a real advantage of having this experience. And I guess between the three of us, somewhere close to 6 or 7 decades of working in this field at the cutting edge.
Absolutely. And I think the just one other thing to mention about that as well is that I think this era of research of natural health products is about, you know, a generation. You know, so 20 years ago there was limited high-end scientific research on specific natural health products, and now a generation later there's some substantial trials of which you guys have been largely part of in this natural health space. So I think we're now talking about a new generation of healthcare professionals, researchers, consumers who are deserving of the benefits of that scientific evidence and these higher grade products. So I think that the timing is great for Metavate. We're right on the cusp of the next stage for the natural health industry, and one where evidence is driving it and not celebrity endorsement and fake news. This is a new start, I think, for the natural health space.
Well, I think there is, you know, a growing interest by the public in terms of understanding research and evidence. And, you know, now with the internet, anybody can look up trials and find evidence for products. But I guess I was sort of interested in your thoughts about, do you think that there is a growing interest by regulatory bodies now to require research evidence for natural medicines and products?
Definitely. So I think it's become too big now to be kind of in the alternative category, where it's kind of, you know, only safety has been the sort of regulatory requirement. So there's an increasing drive for it to move to, you know, this is a part of mainstream healthcare. There are a large number of people in most countries. The majority of the population takes some form of natural health product. So this is not a fringe thing anymore. And as a result of that, I think the spotlight is on from the regulatory environment, from all other stakeholders, so health insurance, public health experts, governments, that are saying this is now needs more evidence to support it, because either it works and we need to embrace it and get it used more, or it doesn't work and it's preventing people taking products that are good for their health, and maybe it could even be detrimental to their health. So I think it's a coming of age. It's moved from the back streets into the main streets, and the main streets are where, you know, as you said, Con, people are looking these kind of products up online, and they're expecting to see that there's proper quality control, the products are made properly right the way from the source through to the finished product, and that they're proven to do something from a positive health benefit. And that proof, why would you not have it if you knew it was available? Why wouldn't you choose a product that was proven to work if you were aware of it? So Metavate is I think part of, you know, a movement. This is a change in our environment in favor of higher standards, better results, and better products, and companies who invest getting better rewards as well.
Yeah, just to pick up on some of the things you said there, both of you, is I think you're right. When I first started in this area, it was definitely this do no harm is enough. And clearly that's not the case anymore. And it's been incredibly exciting to see this almost a paradigm shift in the way that these kind of products are viewed, and particularly the applications of things like neuroimaging, which is something that Khan and myself have been lucky enough to be at the forefront of, seeing a kind of window into brain activity and seeing how that can change when some of these natural products are administered. And it's pretty hard to argue that this is some kind of placebo effect when you actually see brain patterns or patterns of brain activity changing in response to these substances. So it is exciting. And I think the next stage following this exponential growth in evidence for the brain health effects of these products is really translating it for the public good. And part of our job at Metavate, and part of our job as part of Metavate, is to help to educate the public about this. And we're hoping that we're going to have sessions in the future, including interviewing some of the luminaries of natural health, where we look at the evidence for effects not just on mood and cognition, but on things like cardiovascular health, with leading experts in the field.
Absolutely. There's one other little thing I wanted to mention, if I may, which is about the boardroom, the decision making on innovation, the go forward vision of where this sector is going. And I think the one of the things that you both bring, and I think the broader network that we have, is guidance on where is this going. So what's the 5-year, 10-year vision of how the technology and the scientific frontiers are moving in the future. And I think boardrooms need to know this to help guide their innovation, make sure that their products remain relevant in this quite fast-moving sector, and maybe also breakthrough opportunities for products which currently we don't have, that could be of substantial benefit to the public. So that kind of thought leadership, that vision for the future, ideation around trends, I think that's something that's really important that Metavate can bring to boardrooms around the world.
And half of the name of Metavate is about innovate, and that's why we called it Metavate. And our goal is to help companies make more innovative products based on cutting edge neuroscience and health research, and to understand the mechanisms that we could potentially target to improve these outcomes in a really efficacious, innovative way.
Thank you for your attention. For more information, visit metavate.consulting.